Okay, you'll cue me. Good morning. My name is Phumla Williams. We are again today hosting the Minister in the Presidency to come and share with the South Africans the post-cabinet decisions that the cabinet that was held yesterday. But today we are also joined by Dr. Phaahla, the Minister of Health, who is also going to be sharing with South Africans the decisions that relate to the Department of Health. So at the moment, we will allow Minister Gungubele to take the podium, and thereafter we will have Dr. Phaahla, who will also present a statement. We will be able to take questions, which will be directed to both the ministers. And at this point, I'd like to invite Minister Gungubele to come and take us through. Thank you.
Good morning. Thanks, TG. Good morning, ladies and gentlemen from various media houses. Can I get water? I beg your pardon. South Africa at large, our Minister from the Department of Health, Minister Phaahla. Good morning to all. Thank you as always, whenever we make this invitation, with your ever reliable, prompt response. The statement of the Cabinet reads as follows. On the climate change, the Cabinet welcomed the visit of South Africa by Mr. Alok Sharma, President of the 26th United Nations Climate Change Summit from 19 to 21 June 22, and his assessment that South Africa has shown a clear commitment to clean energy transition. In 2021, President Cyril Ramaphosa joined other leaders in announcing a historic partnership with the government of France, Germany, United Kingdom, the United States, as well as the European Union to support a just transition to low carbon economy and a climate resilient society. South Africa has been hard at work in preparing the ground for our clean energy transition and a move to clean energy sources such as green hydrogen, biomass, wind power, solar power, and hydropower, among other renewables. This so-called energy mix allows for balance between energy sources to ensure reliable power to meet the country's growing energy needs. On the coronavirus, Cabinet welcomed the significant drop in COVID-19 infections recorded in South Africa over the past few weeks and encouraged all eligible people to continue to vaccinate, which helps to prevent serious illnesses, hospitalization, and death. Half of all adult South Africans have to date received at least one COVID-19 vaccine dose. Government aims to use the low-interest loan recently approved by the World Bank to purchase additional COVID-19 vaccine doses and ensure that the nation is adequately protected against potential infections. Cabinet also considered matters related to developments on the management of COVID-19 pandemic, particularly with the progress being made towards a full return to normal socio-economic activities. The Minister of Health, Dr. Joe Phaahla, will provide further details on this matter, as you may see. On the National Youth Day, Cabinet thanked all South Africans for joining in the country's National Youth Day commemoration on Thursday, June 16, 2022, under the theme, open quote, promoting sustainable livelihoods and resilience of young people for a better tomorrow, close quotes. The spirit of enthusiasm and reliance shown by youth across our nation is indeed a cause for celebration and a hope for a better tomorrow. As National Youth Month draws to the end, let us intensify our efforts to ensure young people access the many support programs provided by government and facilitate their active participation in the economy. The public service, as largest employer, has responded to this challenge by enabling unemployed graduates to gain experience through public service graduate internship and learnership programs. Government is also implementing the Social Employment Fund and revitalized youth service, job creation initiatives that will each draw 50,000 young people into the economy. These initiatives will not only provide much needed work experience, but will also reinforce the value of active citizenship. The SCF partners with non-governmental organizations, while the National Youth Service enlists young people for service, which benefits communities. Across all these, that partnership will be taking place. In the transport, Cabinet welcomed the 11-point action plan for deal with road blockages and recruitment of foreign nationals as truck drivers. The plan, which was delivered by the Road and Freight Interministerial Committee in partnership with the road and freight industry stakeholders, I beg your pardon, which promotes, amongst other things, the enforcement of visa requirements and compliance with the labor laws. The Interministerial Committee was formed to deal with escalating road blockages and protests by disgruntled South African truck drivers. Protests and road blockages which adversely impact mobility, which scare foreign investors, and most importantly, which negatively impact the economy and essential supply chains which use affected corridors. It was meant to deal with that. On the Nelson Mandela Bay, Cabinet welcomed the interventions of the Department of Water and Sanitation in the Nelson Mandela Bay Metropolitan Municipality in the Eastern Cape to avert day zero as the province is facing severe water shortages which started in 2015. The Department of Water and Sanitation is working with the province to implement short, medium, and long-term measures to address and mitigate the potential impact of drought. Cabinet further urged the residents of Nelson Mandela Bay to adhere to water restrictions imposed by local municipalities to ensure water security. Overall, water use must be reduced by 50 million litres per day from the current level of 280 million litres per day down to 230 million litres per day. On the crime and corruption, Cabinet welcomed the recent arrest of a Home Affairs official stationed at the Benoni office for issuing a fraudulent passport to a Bangladeshi national. The official, Ms. Bongile Simelan, was granted 5,000 bail in the Benoni Magistrates Court on Tuesday, 21 June 2022. The Bangladeshi national, Mr. Fahim Kazi, was arrested while trying to leave the country on the 12th May 2022 under the name Lebogang Ndlovu. The Department of Home Affairs recently deported Lithuanian actress Ms. Liva Andrevajaite, who sought to abuse South Africa's refugee management regime when she fabricated a story of wanting to apply for asylum because of the war in Ukraine. Cabinet commends the work being done by the Department of Home Affairs Counter-Corruption Unit. It applauds and encourages ordinary South Africans to continue to report such criminal acts. The unlawful acts of South Africans who sell their identities have far-reaching negative implications for the country's security and socio-economic status. Government will continue to deal harshly against anyone involved in illegal acts that undermine our immigration laws without fear or favor. Cabinet also welcomed the recent convictions and sentencing of a Durban teacher, Ms. Nomusa Precious Kabuza, who was sentenced to 3 years correctional supervision and 4 years imprisonment, wholly suspended for 3 years in the Umlaza Regional Court in KwaZulu-Natal for contravening the Local Government Municipal Electoral Act 2000 as a teacher at school which was used as voting station during municipal elections in October 2021. Ms. Kabuza pleaded guilty for fraudulently casting 24 votes, including 12 for municipal elections and 12 for the ward elections. The conviction and sentencing underscore the Electoral Commission of South Africa's commitment to intervene timelessly and apply consequence management. This is also a strong affirmation of the electoral system, which have since been strengthened with the introduction of the voter management device that prevents double counting. Cabinet affirmed that elections are the cornerstone of our democracy and must be protected at all costs. On the World Trade Organization Ministerial Conference, Cabinet welcomed the outcome of the WTO MC12 in Geneva, Switzerland, from 12 to 17 June 2022. In particular, the decision that eligible countries could override COVID-19 vaccine patents until 2027. The decision on whether to extend this to COVID-19 therapeutics and diagnostics was delayed for 6 months. South Africa had been leading the call for WTO to waiver intellectual property rights tied to COVID-19 vaccines that will ensure equal access to vaccine and enable countries that have the capability to manufacture vaccine to do so. The conference also committed to an open and inclusive process to reform all its functions and agreed to a package of trade deals addressing areas such as health, setting limits on fishing subsidies, a moratorium on e-commerce trade and food security. On the cabinet decisions, progress on broadcasting digital migration. Cabinet received an update on the BDM, which is Broadcasting Digital Migration Program, noted the progress made with the installation of set-top boxes as part of migrating from analog to digital broadcasting. Cabinet re-emphasized the urgency of concluding the BDM to free up the spectrum needed for mobile broadband and other information and communications technology-related purposes. Communications and Digital Technologies Minister Khumbudzo Ntshavheni will actually hold a media briefing tomorrow to actually elaborate further on the matter. On the annual Child Rights Status Report, Cabinet approved the second annual National Child Rights Status Report to be published. The report provides an update on the implementation of National Plan of Action for the Children for 2019-2024 period. The report highlights the achievements recorded for 2020-21 period. It also highlights areas that remain a challenge, including the safety of children and the continued disparities between the poor and the rich in respect of the children. The report also reflects on how COVID-19 pandemic impacted on children during this period. The intervention measures being implemented by government are aimed at realizing the rights of children as outlined in the Constitution of the Republic of South Africa 1996. They also support the country's obligations to the United Nations Conventions on the Right of Child and the African Charter on the Rights and Welfare of Child. South Africa is signatory to both the UNCRC and ACRWC. The report was compiled in consultation with government departments and a number of relevant stakeholders at national and provincial levels. The full report will be posted on the Department of Social Development website www.tst.gov.za. On the South Africa's combined third to sixth periodic report to UNCRC, Cabinet approved the tabling of the third to sixth periodic report to the United Nations Convention. This report follows the second periodic report that was tabled to the same convention in 2014. The report has been compiled in accordance with Article 44 of the UNCRC and also covers the observations and recommendations made from the last report. The UNCRC sent its observation and recommendations for the country in 2016. The compilation was done in consultation with all relevant departments and stakeholders across the country. The full report will be made public once it has been tabled to the international institution. On the national report on implementing the new urban agenda, Cabinet approved the submission of South Africa's first national report on the implementation of the new urban agenda to United Nations Human Settlement Program. The UN Habitat adopted its new urban agenda at its conference on the housing and sustainable urban development. In 2016, member states were expected to submit progress reports voluntarily. South Africa supported the adoption of the new urban agenda and subsequently implemented it through the country's integrated urban development framework. The IUDF aims to guide the development of inclusive, resilient, and livable urban settlement. The progress report was compiled in consultation with national, provincial, and local spheres of government and relevant NGOs. On the integrated youth development strategy, Cabinet approved this strategy for implementation. The strategy gives effect to the National Youth Policy 2020-2030. It outlines the actions, projects, and programs to be undertaken by various stakeholders from youth formations. It also deals with minimizing the duplication of government intervention and guides how civil society and the private sector can support young people from accessing opportunities. The compilation of the strategy involved diverse inputs from various sectors of society. On the draft white paper on conservation of the sustainable use of South Africa's biodiversity, Cabinet approved the draft white paper on conservation and sustainable use of South Africa's biodiversity for public comments. South Africa's biodiversity provides an important basis for economic growth and development and is critical to people's livelihoods. The white paper gives effect to the recommendations made by the high-level panel of experts appointed in 2019 to review our current policies, legislation, and practices on matters relating to iconic species. The report recommends the development of an overarching policy on conservation and sustainable use of the country's biodiversity. The policy will be implemented across all spheres of government. Conservation is important for the country's drive to accelerate economic growth and job creation. On the game meat strategy, Cabinet approved the publication of the draft game meat strategy for public comments. The strategy seeks to formalize and transform the game meat industry. It also seeks to contribute towards food security in a sustainable manner. The game meat industry is permanently an informal industry that operates in a fragmented manner. The proposed strategy provides an implementation plan that will formalize and strengthen the sector as both a provider of food security and an economic growth sector that can help create job opportunities. On the bills, Traditional Affairs General Amendment Bill of 2022, Cabinet approved the submission of this bill to Parliament for further processing. The amendment seeks to revise the Traditional and Khoisan Leadership Act 2019, which came into effect on April 2021. The protection of constitutional democracy against terrorism related activities and Amendment Bill 2022, Cabinet approved the submission of the Protection of Constitutional Democracy Against Terrorist and Related Activities Amendment Bill of 2022 to Parliament for further processing. Once adopted, the bill will amend the current Protection of Constitutional Democracy Against Terrorist and Related Activities Act 2004. The bill went through an extensive public consultation process after it was approved by Cabinet in May 2021. The amendments seek to align the country's domestic instruments of fighting terrorism with the global measures that have been put in place. They have also addressed the clauses that were deemed unconstitutional by the Constitutional Court. As a signatory to the UN Security Council, South Africa is duty-bound to domesticate the international laws that seek to strengthen measures to combat global terrorism. On the upcoming event, 14th Brazil, Russia, India, China, and South Africa Summit. President will lead South Africa's participation in the virtual 14th BRICS Leaders Summit hosted by the People's Republic of China from Thursday 23rd to Friday 24 June 22. Our BRICS membership continues to benefit the country. Last year, over 17% of South Africa's exports were destined to cover BRICS countries, and over 29% of our total imports came from these countries. The value of this trade continues to grow, with total South Africa trade with other BRICS countries reaching 702 billion in 2021, up from 487 billion in 2017. Collaboration within BRICS members in various areas such as health and an enhanced trade has grown our local industry and benefited all BRICS members. Our investment in infrastructure development projects and efforts to reduce red tape when doing business aim to increase exports to our BRICS partners. On the Economic Governance Winter School, the National School of Governance will host its third Economic Governance Winter School program for political activities in Joburg from 27 to 1st July 2022. It will be attended by ministers from Cote d'Ivoire, South Sudan, and South Africa, and Director General from Lesotho, Zambia, Democratic Republic of Congo, Tanzania, and Ghana. South African mayors, as well as members of mayoral committees and executive, will also attend. The political executives from different countries are expected to share ideas and lessons from different scenarios that they experience in their day-to-day work. The NSG designed the annual program for members of the executives in 2020 as part of its support to government commitment to build a capable state. It seeks to, among other things, equip executives within 3 spheres of government with enhanced leadership and oversight capabilities to be able to re-examine governance challenges that constrain inclusivity and sustainable growth, economic growth. On the Nelson Mandela International Day, this year's Nelson Mandela International Day on Monday, 18 July 2022, will be celebrated under the global theme, open quote, do what you can with what you have wherever you are, close quotes. It is a clarion call for all people to support and participate in the campaign by contributing sustainable intervention with a lasting impact. One such sustainable intervention is the annual Nelson Mandela Youth Dialogue and Ethical Leadership Program, focusing on topical issues concerning young people in South Africa and across the globe. On the tax season, the 2022 tax filing season will open from 1st July to 24 October 2022. Taxpayers are encouraged to file their returns on e-filing, www.sars.filing.co.za, or on the South African Revenue Service, SARS Mobi app. This year, SARS will continue with the auto-assessment of individual taxpayers, which is pre-populated income tax return to help simplify the submission process. In 2021, more than 3 million taxpayers were also auto-assessed. The timely and accurate submission of tax returns not only ensures taxpayers remain compliant, but it also helps government to deliver services to South Africa who need them most. On special messages, Cabinet extended its congratulations and well wishes to the following: Judge Owen Lloyd Rogers, following his recent appointment as a judge of the Constitutional Court of South Africa. Cabinet joined President Ramaphosa in wishing former President Thabo Mbeki a happy 80th birthday, which is celebrated on the 18th June 2022. Mr. Mbeki envisioned a bright and a prosperous future for all South Africans. On the appointment, all appointments are subject to, as said before, to verification of qualifications and relevant clearance. Non-executive directors of the South African Civil Aviation Authority Board, which comprised of the following: Mr. Ernest Khosa, Ms. Bulelwa Koyana, Ms. Sandra Soklala, and Ms. Rejoice Edith Pewa. Members of the Office of Disclosure of Home Loan and Mortgage Disclosure, Ms. Kinosi Pel Luis Selani, Chairperson, Ms. Catharina Maria van der Sant, Ms. Errol Vincent Magaman, Advocate Mandla Dudlu, Mr. Muchwabane Gabriel Melo, Ms. Palisa Mawasha, Ms. Penelope Ann Beck Paxton, Ms. Piwa Doris Mainga, Ms. Chifiwa Victor Mapingalale, and Mr. Zuko Namani. Thank you very much, ladies and gentlemen.
Thank you very much, Minister. I think we'd invite Dr. Phaahla.
Thank you very much, DG. Greetings to my colleague, Minister Gungubele, to the other DG present of DG of Health, and to our chairs of our ministerial advisory committees, the Advisory Committee on Social Behavior Change, Bishop Mpumulwana, thank you very much for your presence, and Professor Koleka Mlisana, our co-chair for the Ministerial Advisory Committee on COVID, and representing the MEC on vaccination, Dr. Leslie Bamford from the department, who's a member of that Ministerial Advisory Committee on vaccination. Ladies and gentlemen, today we believe it's indeed a very historic day where we have reached a major turning point since the outbreak of COVID-19, both in the world and in our country specifically. And I'll take you a brief journey back as to where we come from. We recall that our first case was confirmed on the 5th of March 2020 in Pietermaritzburg from a South African who had traveled to Europe. Subsequent to that, President Ramaphosa constituted the National Coronavirus Command Council, and following a meeting on the 16th of March, he announced a nationwide lockdown, which was to take effect from the midnight on the 19th of March. So just over 2 years and 3 months to where we are today, with a strict stay at home. I hope you still remember that, unless you had permission to undertake very essential services. Since then, we have gone through full 4 waves of the COVID-19 pandemic, with the first 3 waves causing major devastation with a lot of loss of life across all sectors of society, including health workers. And on this note, Chair and Minister Gungubele, I think we also remember our colleague, former Minister Jackson Mthembu, who used to preside over this kind of briefings, who was one of the victims of this COVID-19 pandemic. Disruptions of social and economic life have been huge, Most painful of all being families unable to visit loved ones who are seriously ill with this virus in hospitals, and even more so that those who passed away had to be buried under strict conditions with only a few family members able to attend. On the economic side, we've witnessed major losses of jobs, closure of several businesses, especially small businesses. But we also see that even big businesses have suffered. We know of many hotels, especially the hospitality industry. There are many hotels which up to today have not yet opened. To delay the spread and allow health facilities to prepare, even as the lockdown was slowly lifted or reduced, a risk-adjusted strategy was used to continue to contain the spread. In February 2021, we started with the vaccination program under the Sisonke program led by the South African Medical Research Council, starting with health workers and followed with the educators. In May, the same year of 2021, we were able to start with high-risk population on an age-adjusted risk, starting with the 60 and above, and progressively moving through the ages until we could reach to the young people, the children of 12 to 17 years in November 2021. We want to take this opportunity on behalf of all government to thank all South Africans for their support and cooperation over this last 2 years and 3 months. While there was a lot of common ground and agreement even across political divides, political parties, early in the pandemic, when we all thought it was going to be a short stint and will be over in a few months, the longer it took, the more people felt the fatigue, and disagreements emerged on strategy on how to, whether the government was correct in the measures taken. We appreciate the fact that notwithstanding those disagreements, even leading to court actions or threats of court action, but essentially, the main frame of our approach of protecting society by flattening the curve did remain in place, and a lot of South Africans supported that. So we want to thank South Africans for the resilience in internalizing various measures of prevention and mitigation against the virus, some of which are going to help us even going forward in dealing with some of the old infectious diseases like tuberculosis, also just managing diseases, seasonal diseases like influenza. I'm very pleased to, from time to time, listening on the media, even early this morning when people were interviewed, many of them said, we're not ready to drop the mask because we know that it has helped us. The masks have helped us to avoid flu and other diseases, and we have seen that it works. So these are some of the legacies which we will keep. We thank the collective leadership of our country across all sectors, such as the faith leaders, civil society, traditional leaders, business, academia, youth, women, for rising to the occasion. Even though we did not realize our goal up to now of 70% vaccination, which we had thought we would reach by December, and we had the capacity to do that, at least of the adult population, we take solace on the achievement that as of last night, 37.7 million doses of vaccination have been administered to 20.09 million individuals, adult individuals, and 1.9 million children of between 12 and 17 years. So all in all, just a little short of 22 million South Africans have had a jab. So we applaud also especially the big turnout of the 60-plus age group who surpassed the 70% coverage. As we speak, the 60-plus age group stands at 70.5% coverage with at least one dose. And also the 50 to 59, just over 66% coverage. We believe that the big turnout of the over 50s contributed hugely to the reduced severity and hospitalization and reduced mortality, which we have witnessed in the fourth wave, which started in the middle of November. And even as infections persist today with the smaller fifth wave, which we've just exited, the mortality and severity rate have been smaller, and we attribute this largely to the fact that the over 50s have vaccinated at just below 70 on average, with the over 60s having surpassed 70%. Because also this is the age group which is highly at risk. We also want to recognize amongst all our partners, colleagues in the provinces, the fact that the Free State province stands out as the only province which has reached a 60% coverage of its population coverage, so at 60.15%. The Free State started at a slow pace, but soon picked up, and they never looked back after that. And at the present moment, they are the leading province. And just behind the Free State is the Western Cape at 57.3%, then Limpopo 57%, the Eastern Cape at 54.5%, and lastly in the 50s is the Northern Cape at 51.5%. Gauteng province have vaccinated the biggest number of people in terms of head count, at 5.4 million. But because of its population size, this, in terms of coverage, has not surpassed 50%, still stands at 47.8%, simply because of the fact that Gauteng has a big population. And together with KZN and Northwest and Mpumalanga, they somewhere between 45 and 50, just below 50%. The Omicron variant driving the fourth wave, with its spread affecting the highest number of people, contributed also, we believe, to increased natural immunity, which has also helped going forward in terms of reducing severity, hospitalization, and deaths. Now, in March this year, when the impact of the fourth wave started waning, government took the decision to exit the Disaster Management Act, as we know, as an instrument. And at the same time, the Department of Health published amendments to the 2017 health regulations on the surveillance and control of notifiable medical conditions. On the 5th of May, we published a limited number of 3 regulations to provide a framework for mitigating against a spike in COVID-19 infections by subvariant of the Omicron, subvariant B.4 and B.5. During late April, 2 months ago, and during the course of most of May, there was a significant peak in daily infections across the country, starting to drive increased admissions to hospitals and also reported daily deaths. Daily infections rose during May from as low as about 250 per day to reaching high levels of just under 8,000 on the 15th of May, with a positivity of 22% on the 1st of May and 20% on the 15th. But by mid-June, the situation had taken a very positive direction, with decline in daily cases, a decline in hospitalizations, a decline in positivity rate, a decline in the reproductive number of the extent to which the virus replicates and infects the next person, and also decline in the reported deaths. Having monitored the positive direction, this positive direction for more than 3 to 4 weeks, we came to the conclusion that the peak infection, which we also attributed as a small fifth wave, driven by this subvariants I've mentioned too, but not driven by any variant of a new variant of concern, that this fifth wave was indeed dissipating quite quickly, and that there was no more any imminent and risk, in terms of the COVID pandemic. It is on this basis that we approached the NCCC and the National Health Council, which is made up of MECs of health, that we're making proposals that the limited regulations which we had promulgated should be considered for repeal. And this was supported by the MECs. Just to remind you that these limited regulations pertain to wearing of masks indoors, limitation on numbers in both indoor and outdoor gatherings, and also vaccination proof in these gatherings, but also proof of vaccination and or PCR negative at the ports of entry. So all the consultations were successful, and as of yesterday, we got the approval from Cabinet that we can go ahead. And also before that, the premiers, mayors, through the President's Coordinating Council also gave their unanimous approval that we can go ahead and repeal the remaining regulations. And as a result of this, last night I signed a note for Government Gazette lifting the 3 remaining regulations. So we thank the leadership of our President and the Cabinet and the premiers, the MECs for Health and other MECs, the mayors, councillors, and all those who played a role in helping us to manage the high peak of the pandemic. We also thank leaders of civil society, again our faith leaders, business, labor, and traditional leaders also for their contribution. I want to take this opportunity also to thank our ministerial advisory committees, as represented here by the chairs of the 2 committees and also by Dr. Bamford, as I have acknowledged earlier on. As I want to move to conclusion on the COVID, we just need to end with a caution that the COVID-19 virus is still around. It's not gone. It's still here. That's why Prof. Mlisana, I'm sure later on, can take some questions because she also is with the National Health Laboratory Service. That's why on a daily basis, they still report the number of cases reported as positive and also admissions to hospital. And people are still passing away from this virus. We are just currently more stronger, as I've mentioned, the attributes as to why we are stronger now, from the vaccination and also element of natural immunity from the various 5 waves which have now been in our midst. And we therefore urge everybody who is not yet vaccinated, who qualifies above the age of 12, to please take the opportunity to get vaccinated. And those who qualify for boosters, to take the opportunity to get vaccinated, to get their boosters. So going forward, the vaccination program will remain and is now being integrated into the normal health services as part of our primary health services. So we urge all leaders of society and organizers of events to work with our health sector workers to promote healthy living, healthy lifestyles. And we urge every one of us to know our status. This status can relate to what is our blood pressure. We need to know regularly what our blood pressure is, blood sugar, what is our blood sugar level, whether we have been screened for various forms of cancer, breast cancer, prostate cancer, colon cancer, our HIV status, and also if we have any respiratory symptoms, test for COVID. The next matter which I want to touch on is the monkeypox. I'm sure many of us have known that there's been a lot of spoken about monkeypox, which is spreading in various parts of the world. Late yesterday, I received a report from the National Health Laboratory Service indicating that they have confirmed through a laboratory test the first case of monkeypox in South Africa. The patient is a 30-year-old male from Johannesburg who has no travel history, meaning that it cannot be attributed to the disease having been acquired elsewhere. So it means that it is with us. So working with the relevant health authorities, a process of contact tracing has started to trace the close contacts of this gentleman. Monkeypox is usually a very mild disease, manifesting as blisters on the skin. It is usually mild and self-limiting, with a very limited fatality rate of about 1%. The disease has previously been reported in African countries such as Nigeria, DRC, Central African Republic, and Ghana in the early 2000s. The current outbreak is dominated by high numbers in Europe. The UK is currently leading just over 700 cases, Spain just over 500, Germany, Portugal, and France. Cases have also been reported, in both cases just below 200, in the US and also in Canada. So the NICD is conducting online service in-service training for our health workers, for them to be able to detect the disease so that necessary laboratory tests can be done. The disease only spread through close contacts and not through droplets. So very dissimilar, very much unlike COVID and respiratory. It's not a respiratory disease, and it spreads through contact with an infected person. That's far in terms of the history from where it has emerged. It has shown to be more dominant amongst men who have sex with men, but it just emphasizing the fact that it is mainly through very close contact. That's how it is transmitted. So lastly, again, let me just thank all the colleagues who have worked with us, MECs for Health, also from the private sector partners. A lot of private sector partners have been on board, especially on the vaccination. We are still very much involved. And again, our ministerial advisory committees. We're looking forward to redefining the role of the committees and discussing what is the way forward. But because, as I've said, the pandemic is not yet over, we're going to have to discuss that, but also look at other roles in terms of overall healthy lifestyles for our people. Thank you very much, DJ.
Thank you very much, ministers. I will entertain questions. I don't know whether who's going to be helping me with the questions. Irene?
Thank you, Gigi. Good morning, ministers. I have a number of questions from journalists, so I think we should take 2 rounds of this. So the first questions are from Simon Naidu. She is saying it's been over 2 months since the President declared the national state of disaster in response to the floods that hit KZN and Eastern Cape. Can the minister clarify if this is still in effect, and if so, when will it be lifted? The second question, we are approaching the first anniversary of the 2021 July Unrest. Can the minister give an idea of how government plans to commemorate the anniversary? The next 2 questions are from Tamar from Business Day to the Minister of Health. What is the status of the regulations to the National Health Act that you previously published for comment? Are you still pressing ahead with this process? All
right, we're going to come out of that briefing to take you to another live briefing. Some senior members of the AmaZulu royal family claiming they're not being consulted.
Next question from Paul from Bloomberg. Has the South African government made a decision about expanding full BRICS membership, in particular that of Nigeria and Argentina? You let me know, DG, when to
Okay. That's about how many now?
I've read about 6.
6. Ministers, can we continue, or you want to deal? I think primarily on health. Should we take this round and then I think let Minister respond, because there are quite a few of health.
When we were coming here, both Minister Gungubele and Bishop Mpumulwana said they are going to keep their masks on until they can confirm that it's real and it's not just the fake news. So let me confirm that it is real. But again, maybe just to say, take this opportunity maybe just to clarify what is off the table. It's a compulsory wearing of mask in certain settings, which over the last 3 months or so was only in indoor meetings and indoor settings. So that the compulsory nature. But we emphasize the fact that masks have proven to be very good in preventing, especially respiratory transmission of respiratory diseases. And we also need to maybe just add to say we would still encourage citizens, especially in indoor settings, especially where they are gathered with other people, feel free to wear a mask because it has shown, the mask has shown to be helpful in terms of preventing especially respiratory transmission of respiratory diseases, especially if you consider yourself and your practitioner, medical advisor as at risk in terms of age, in terms of comorbidities like diabetes, heart disease, and respiratory diseases, chronic lung disease, having had TB, for instance, before, and all those kind of ailments. So I would want to urge all South Africans that don't feel embarrassed simply because government has said it's no more compulsory. All that you are saying is it is in our hands now to make those decisions, as also advised by our health advisors. So please, it mustn't be as if now it means because the regulation has changed, everybody must just throw away. We wouldn't like to interpret it that way. The regulations which we published still remain out there for consultation, for amendment of the surveillance and control of notifiable medical conditions. Remember, what we were amending was existing regulations for control and surveillance and control of notifiable. Now, COVID is just one of those diseases which got classified as a notifiable medical condition because it became a notifiable disease. It was already it was already classified in terms of the term which was used was a novel respiratory virus. So it was a broader classification under notifiable medical conditions as a novel respiratory virus, which covers any kind of such viruses. And we subsequently specifically mentioned COVID in the amendment. So we will be continuing to amend those regulations to make sure that they are also user-friendly in terms of other pandemics, more than just when the regulations were drafted in 2017 were meant to. So we're going to continue. We're going to look at all those submissions and now look at a more long term, but also in preparation because, as we have said, there is no certainty as to just the COVID virus itself. There is optimism that it's now becoming endemic and it will remain like that. But until quite some time that it's stable, first of all, there is no certainty that you will never get a variant which can complicate and escape all the immunity of what we have. There's no certainty, but Prof. Mlisana is more qualified than me to. I'm just a generalist who has not practiced for 30 years. And she's the specialist in this area. So if there are further questions, they can. But in terms of regulations, yes, for that question, we are going to continue looking at amendment because there must always be regulations to deal with notifiable medical conditions. The question as to whether schools and old age homes and other settings can still demand people to only be allowed with masks. There are many premises now, no mask, no entry. So I think the question relates to that. Our response to that would be that that's really, if you run a facility, whatever that facility, you have the right to determine regulations, whether you run a shop, whether you run a restaurant, whether you run a hotel, you can have your own regulations for that facility, which you are comfortable with, and your clients are happy with those regulations. So If the managers of a school or old age home want to keep the mask, if the parents' body, what is it called? The school governing body of a school, for instance, just as an example, meet and decide that for the purpose of their school, they are happy with their children wearing masks in the school. That's the school policy, but it's not the government policy. So I think we must just make that distinction. So that will apply to all public places. It will be up to the members of such bodies and also regulators and owners of such facilities to make those decisions without government having any say. Thank you.
Thank you, DG. Thank you, Dr. Phaahla. You see, I was wearing it as per the law. If I wear it next time, it will be self-precaution, which remains important. My questions are very short because they are more factual. State of disaster is still in effect. Commemoration of July, I know of no details, except that we stay alert in case those crazy ones are contemplating repeating what they refer as their impact. On the BRICS, I think the DECO or Minister of Foreign Affairs is better placed to give us the details. All I can say, such applications do take place, and there's the detail of where are we. DECO is better placed, but I wouldn't say that. I imagine at all material terms, BRICS would not ignore any application that takes forward its objectives.
Irene, I'll take the House journalist, Heidi.
Minister of Health, Dr. Joe Phaahla, I just have two questions for you. I just want to get a sense of vaccine availability. I know there's an oversupply because people are not getting vaccinated. Do we know how many vaccines we still have and how many are set to expire because they're just not being used? Is this a concern for you? Next question. It's breaking news all over now that we have one case of monkeypox and everyone is freaking out. As the health minister, maybe if you can just provide some clarity that should we be concerned, should we not be concerned, because this is all deja vu, because this is what happened with COVID. We had our first case of COVID and everyone said, don't panic, relax, and almost 3 years later, it caused a lot of devastation. So perhaps if you could just provide some clarity there. Another question, you mentioned something now where you said, whichever facility it might be it a school or a restaurant or an old age home or whatever it might be, if they are in a position where they feel that you should wear a mask, it's going to cause a lot of confusion. So maybe if you could just, clarify that specific point, because some people are already out today with no mask because they feel the regulation is lifted, we don't have to be in a mask. But if other facilities are saying you have to have a mask, it's just going to cause a bit of confusion. So if you can clarify that. Thank you.
Thank you. I think we can take some more questions because I'm told there's quite a lot of them. Irene?
Thank you. The Minister has covered most of the questions on the regulations, and I have two questions now from Gaugelo from UFM to Minister Gungubele. Did Cabinet discuss the 3% pay hike for public office bearers, in particular the public outrage over the decision? And is there a single minister who expressed discomfort with regard to the pay hike? The second question, has the Cabinet discussed the criminal actions against President Cyril Ramaphosa? And if not, why was this not dealt with when there was time to talk about arrest of small-time criminals, and more so when the President is increasingly becoming a story and one that overshadows his work as the head of state? those are the two questions that I think have not been.
I think we generally take 2 rounds, and I'm hoping this is the last round, unless there are others.
Yes, there is.
Okay, so should we take, are there many?
Just one.
Okay, let's take that.
Additional question from Sumen. Did Cabinet discuss the high cost of living and increasing prices of basic essentials such as food and petrol, and does government consider it to be a crisis?
Okay, thank you. Okay. We've got health and we also have cabinet.
Thank you very much. Yeah, in terms of the vaccine stocks, I'm afraid to go into hard figures because they also change. But what we can say is that we still have substantial numbers. There has been some good response from some of the contracted suppliers like the COVAX, where we were due to receive quite a sizable consignment of vaccines which we had ordered before, but which are mainly Pfizer. But due to the slow uptake, there's been further negotiations, and COVAX have agreed to waive that commitment. So in terms of that, I know that we will save just around 1.4 billion rand in terms of the cancelled supply of those vaccines. At the current moment, our team is also negotiating with Johnson & Johnson for commitment of future delivery, also to try and negotiate that that also should be waived. It does present difficulties, as you would have heard from Aspen Pharmaceutical, that they've invested a lot in the vaccine manufacturing, and now that there's a very limited uptake. And so our negotiation also get complicated by that the businesses, the companies which have put up a very costly infrastructure to produce, also having difficulty in terms of maintaining the staff and those operations. But we estimate currently that close to 8 million Pfizer doses will be in danger if the slow uptake continues. That is vaccines which are in the stores, in the fridges, in the central storage, and also some of which are already out there in the facilities which are doing vaccinations. So there is definitely a risk. The Johnson & Johnson vaccines have got are more stable, so they can stay for much longer. We don't have the immediate risk. So the ones which we have immediate risk is the Pfizer doses. By November this year, if there is no major uptake, we will have a serious risk of anything up to about 8 million doses, which may have to be discarded. But on the J&J, they can stay much longer. In fact, in terms of let me just leave it there to say that's. I think we can look at the finer numbers, but those are the kind of numbers I can offhand be able to respond. The issue of monkeypox, as we have said, I know that as Heidi is saying that we almost looks like, as we say, we are now reached a turning point with COVID. It looks like we're starting a new battle. There's a vast difference in the sense that monkeypox is not new. It's been there. It was detected many years ago. as I've indicated, up to the early 2000s in Ghana and other West African countries. It's also similar, well, many viruses, again, I'm sure Prof. Mlisana could shed some more light. Most of these viruses come to human beings from animals, the same way as the COVID, and that's why this one is called monkeypox. But it's been there for more than just over 20 years. And so it's quite well established that in terms of its severity, it's very limited. It's self-limiting most of the time, very mild symptoms with blisters on the skin. Except for some time in immune-compromised individuals, including people who are on HIV treatment but who are not stable, who are not utilizing their ARVs in a very stable form and therefore not virally suppressed. So in the category of immune-compromised individuals, it can become serious, but overall, in terms of most individuals, it's not a very severe illness. But also because it's not spread by simply being in the environment where there might be somebody with the disease. There has to be actual contact, with a person who is infected with the virus. So for that purpose, we would say that, just to avoid, because even 1% fatality does mean there are still people at risk. So because of that, all precautions in terms of contact tracing, isolation of people who have been confirmed to be positive will be happening. But I can assure South Africans that this is not a novel virus which has never, been seen before. Its characteristics are well known, and even currently in the countries where there are high numbers, it's the same. It has not changed in terms of its character and its severity. The confusion around masks, well, I would say that this is still very fresh. I mean, we're talking about less than 24-hour kind of a decision, formally promulgated about 12 hours ago, maybe even less, maybe just around 12 hours. I think we got it into the Gazette just before midnight. So it's understandable, therefore, that in these early days, there will be confusion. With time, it will settle. But the main issue is really, again, to say that as a public health measure, it's no more an obligation, as it has been. Managers and owners of facilities can take their time, negotiate, of course, with their clients in terms of how they're going to manage that. If, because of the health benefits of a mask in indoor situations, if some of those managing facilities want to retain the safety, because as we say, the COVID and even other respiratory diseases are still around, going to be around with us. So I think let's give it time, and people will really, it will sink, and both as individuals and using facilities and those managers of facilities will come to a rational decision. I think maybe it's too early to panic about confusion. I wouldn't be worried if there is confusion in the first 24 hours as people digest. I did imagine, just one day when I was somewhere in the mall and just seeing the way people have become so comfortable. And I was saying, because as we were discussing this, I said, sure, we're going to confuse people, because now, from the period where it was quite a change when the thing of masks started, now that this has settled down, people become accustomed to it. The change is always a bit problematic, but I think with given time, people will make decisions and there will be certainty.
Normally, when you are asked questions, I heard journalists say, good question, or politicians. I don't know how to rate these questions, but I prefer not to. They are not good questions when you go for a weekend. The question on 3%, the cabinet didn't discuss that question. But you would have remembered the president spoke about this matter in Parliament, about a number of times political office bearers never had increment, and the kind of families that they have to look after home and in Parliament. Now we look after 2 homes. It's quite a number of years that has happened. If it happened, it's very, very low level. But I think maybe when the Minister of Finance comes, he may be better placed to explain. But all I want to explain, there's rationale behind the President's decision. It's a matter that will have to be clarified as we go on. That's how far I take the matter. On the Phala issue, Cabinet, of course, didn't discuss the matter because the Cabinet respects the President's approach on this matter, that when this matter came to the fore, the President made an undertaking to cooperate with law enforcement agents. I usually say whenever this question is asked, the President, during his presidency, has been confronted a number of times with regard to whether he is doing his work legally or not, or he is running his life legal or not. A number of times he subjected himself to the institutions of the state, which are responsible for that exercise. And this is no different. I were to ask South Africa to look at the President on the basis of how he has submitted himself to these processes before, unless you suspect something before, against that background, because there's nothing now where we are sitting that said the NPA says, we have found these findings. On the basis of these findings, the President is being charged. Imagine if every day everyone would say, I'm charging the President. You've seen people marching to courts saying, I'm charging Joe and I'm charging DG. Imagine how many times you would stop before you do your work when the proper processes have not been done. As you all know, the President is a man of processes, as he has demonstrated that several times. My appeal is that let's allow those processes to take place, and we believe President, knowing who he is, if there's any decision he has to take about those matters, he would do it because there's no history that suggests otherwise. On the cost of living, I think the Cabinet is worried about the matter. But in this Cabinet meeting, it's not the matter that has been discussed because we continue looking at the sources of the pressures that lead to these costs, be it Ukraine, scarcity of food, scarcity of grain, scarcity of what to call oil and so on. The Minister in Energy and Finance are the ones who are monitoring the situation. And we know when the time comes for the Cabinet to consider any proposal, and the Cabinet then will pronounce itself. Otherwise, the Cabinet is aware of the challenges. They are quite not looking good. Thank you very much.
Thank you very much, Ministers. Before I close, I wanted to...
I didn't see there was something I just want to respond to which...
Okay.
Okay. Just to clarify something new. Okay. Well, the first one is somebody who's asking if we can give details of the monkeypox case. We can only give details in terms of on the public health related information, but beyond to say that the case is confirmed in Johannesburg, in a male individual, and there is further tracing of contacts, we can't go any further, because that then will be getting into the privacy of a patient. The other one is concerned about the fact that I also mentioned that close contact is the spread, but also mentioned that there is a reports which indicate predominantly men who have sex with men. As to why would this be different from heterosexual in terms of contact. That is that's for the clinical dominant reports. And some of the suggestions is that it could relate to how the early spread happened, and therefore continued in the line of a particular kind of a trend. Not because, but I think the main issue is that it is spread on close contact, but possibly because of how it's sort of transmitted to human beings early. It continued on a particular trend, but that would not suggest that it's exclusive. So there is quite a high possibility that that dominant trend may change any time. That's just what is on the reports currently, on the clinical reports currently. But I'm sure those who are interested, I would again, we must not underutilize Prof. Mlisana as the expert here who can also make some comments on this matter.
Thank you very much, Minister. I was actually going to invite to the Prof. I don't think we can be shortchanged. We want some additional information from the Prof. So, Prof, can you take the floor? Please come here, because I think that's where. Thanks, Minister.
They want to understand this monkey business.
Thank you, Minister.
Thank you, Digi. And good morning to the ministers, and thank you for the time, and the other Digi that's in the house, and to everybody else. Maybe let me just start here, from the minister's comments. I think obviously everybody, most probably everybody in the country, welcomes the state that the minister has just announced with regards to the COVID pandemic, as well as the restrictions that were still remaining. And I like the emphasis that the minister is making, that we really are now moving into an era of endemicity insofar as SARS-CoV-2 is concerned, which means we need to move away from containment to mitigation. We need to move into how do we then live with the virus as we have lived with all the other viruses. And so what basically this is doing is that it is moving us away from mandatory actions to really looking at health promotion. And so for me, I agree with you, Minister. The individuals who are actually saying, I will continue to use my mask, I want to support those, because we now need to bring the responsibility of prevention back to the communities, which means if you know that you are not well yourself in the first place, then it becomes your individual responsibility to protect those around you. And the issue with masks is that it's important how you wear a mask and what kind of a mask that you're wearing, because obviously when we're talking about do we drop away all the masks? We need to identify what are some of the high-risk, environments, and where then we would ensure that there is mask wearing. And one of those actually may have, as already highlighted, it might be in long-term facilities where people are not vaccinated. But the most important is going to be among healthcare workers, because when we're talking about masks, especially the respirators, we know that they protect not just COVID-19, but a lot of other respiratory infections. So when we're looking at TB hospitals, patients that are sitting there, it's going to be important to make sure that the behavior and the wearing of masks must become a norm, with us as a country. And even for individuals, then if you know that you've got flu, if you know you've been diagnosed with TB, you want to make sure that you wear that mask so as to protect the others. So we really, truly welcome, the decision, Minister. Monkeypox, as already highlighted, is actually a disease that's endemic in Central and Northern Africa. We have known about it. It's a mild form of a disease. It actually, the lesions may, there's similarities of monkeypox to smallpox, which has been eradicated. And as the minister says, there are vaccines for monkeypox, and there's actually treatment for monkeypox. How it presents is like a flu. You can get a flu-like symptoms, and you can get lesions. So the important thing is that really somebody who comes up with a clinical picture, it is easy to diagnose. And most importantly, it is difficult to transmit. It's unlike, a respiratory virus, because it is by contact, which means then you would only get it when you really have come into direct contact with somebody who is infected. Why are we talking about men who have sex with men? It is because, it has always been endemic in Central and Northern Africa. But lately, there have been, as everybody is aware, there have been cases of monkeypox outside of Africa. And I think there's about just more than 1,500 cases that have been identified thus far. And if you're looking at those cases, they have been mainly in men who have sex with men. It does not mean it only gets transmitted through, men who have sex with men, but any direct contact. And the minister is correct in saying why we have seen this trend within men who have sex with men. That's probably how it was originally, introduced in these countries that are outside of Africa. But the important thing is that we are able to diagnose it, as has already been announced. And secondly, it's going to be important to monitor and make sure that whoever the individual who is positive, who they have been in contact with. So contact tracing is going to be important, and we'll continue to do that. But right now, it's just the one case, and it's for us as the lab people to be on the high alert and be able to identify should there be more cases and whether there's actually, a localization of those cases. But I really just want to assure everybody that, especially also with with everything that we have learned from COVID-19, when we're looking at the laboratory infrastructure, we've got all that it takes to be able to monitor any other new infections that might be arising. Let me end there, Minister. Thank you.
Thank you very much, Prof. I think at this point, I am just going to adjourn and thank the two ministers for availing themselves, and also the Bishop and everybody else, and my colleague DG for joining this media briefing. Thank you very much. We stand to adjourn. So what?